Many surgeons have concern about patellofemoral because this patella tracking is like this. The nearly the same as tibial anatomical, femoral anatomical axis following, but it's quite variable. So uh, the current femoral component is designed for mechanical alignment. So it has the lateral shift from 5 to 7 degrees. In fact, that is the equivalent to the difference between the anatomical and the mechanical axis of the femur. Okay. So, but in kinematic alignment, femoral component is aligned to not to the anatomical axis, but joint like this. So eventually, the groove line of the femoral component comes slightly medially. So eventually, that can affect the patella tracking. The patella groove move medial and the patella move lateral. Eventually, patella lateral dislocation or subluxation or shifting or tilting are the concern after patellofemoral joint, after kinematic alignment, TKA. So, in terms of femoral rotation, the groove is here. So also, this is designed for a slightly externally rotated position because the this femoral component is aligned to the SCA that is externally rotated at approximately 3 degrees. Okay. If we insert femoral component parallel to the PCA, the groove of a femoral component comes slightly medially than the native groove of the femur. So, okay. So complications such as dislocation of patella, patella fracture, or necrosis, uh, or subluxation is frequent, and larger stress on the PF joint. And lateral shift and lateral patella tilt is often, in, especially in early flexion. So, but in terms of clinical outcome, uh, there is no difference so far in meta-analysis. This is an anatomical study. So KA is more closely, more perfectly restore the native groove location. See, this is the KA and MA groove line on the femoral component. OK? こっちが MA で、こっちが KA ね。うん、で、えで、これが、ペルソナ and next gen and vanguard. So group lines are more close to uh, the KA side. So this is the anatomical study. The further, this is a variation of this paper consider the variation of the femoral anatomy. So this is a femoral uh, femur that has 83 degrees of femoral bone. This is slightly bulbous than normal one. This is the 93 degree. That is a slightly bulbous impression of the distal femoral. It MA is a prosthetic sulcus comes to maybe lateral. No, two, yes, two comes to lateral. But native sulcus and mechanical circuit. This is the MA. And the KA is almost the same as the natural slope. And this is 93 degrees of very valgus female. Even in the very valgus femoral component joint line, so kinematic prosthetic line is nearly close to the native line. So compared to the MA, so kinematic alignment, so prosthetic group comes closer to the native line. Why? Because the mechanical alignment in the joint line, native joint line is ignored. So just align to the mechanical axis. So that group is maybe highly affected by the variation of the distal femoral. So if we ignore the distal femoral line, the group, the mismatch of the group and component group can occur. ちょっと話難しい。MA っていうのは、要するに、ジョイントラインを無視するわけですよ。で、軸ばっかり考えるから、この角度にあってグルーブが形成されている。それを無視するから、かえって、食い違いが大きくなるん違う。それに対して、これのジョイントラインに合わせて設置することで、結局グルーブも合ってくると。というふうな考えを言うたはずですよね、この人はね。はい。っていうことになります。So, but this is the story in the early flexion, early to mid flexion. But if we consider in the deep flexion, the problem is deep flexion. And early flexion doesn't matter in terms of knee motion and knee flexion. So maybe the patellofemoral is highly related with in the position of the deep flexion. If patellofemoral joint is not perfectly matched to the native, maybe this flexion can be disturbed. So, in the flexion in the mode of 19 degrees, patella come to the distal to the femoral. But because the mechanical alignment ignore the joint line and just align to the mechanical axis. So distal joint line can change. Eventually, so lateral tightness can occur. But in kinematic alignment, it just restores the native one. So the patella come to the very neutral position, natural position, for that this patient. So this is another reason to the patellofemoral is not so bad in kinematic alignment. So this is one answer. There is no difference between the kinematic alignment and the mechanical alignment. But concern is early flexion. So because this in the groove angle is actually very variable, sometimes very various and variable. Regardless the kinematic alignment or mechanical alignment. So group, especially in the early flexion, is quite variable. So we should accept the wide variation of the group or patellofemoral tracking. So Metacoda launch the spherical knee that have the wide group and the relatively flat group. they have the lateral ridge like this, but this ridge is slightly lateral. So the concept is, so this can adapt to the wide variation of the patellofemoral in the early flexion, but in the deep flexion, patella must be placed at the center of in all cases. So the concept is the patella position can be accepted. So variation of patella position can be accepted the medially but restrict to lateralized patella. But this angle is 20 degrees, very wide, very wide. So medial one and lateral one can be accepted. Instead, if patella comes to slightly lateral, we can use the persona narrow component. It has a slightly wider or lateralized patella growth that is 10 degrees. The normally 5 to 7 degrees. So 3 degrees or more for giving in the R flexion patella. But in the D flexion, again, the patella comes here. So it doesn't matter maybe as long as we do the kinematic. わかる言うてることは。要は、この部分にパテラ来てるときってどこに来るか結局分からへんから、まあ、ある程度、ふわっとどんなところでも受け取ってあげて、で、深呼吸になってパテラがここに来るときに、いいところに来るように導いてあげたらいいんだけど、あんまり早いうちにここにあったら、やっぱりここのところでゴリゴリ擦れてしまう。あかんかなっていう。So, this is a spherical knee. So that is the next time you should observe, you should look this figure. Normally, it has the convex shape, concave shape like this, but this has a very flat median and high reach to the lateral. So, there is under controversial, but the parallel is the bad or good in the kinematic alignment compared to the mechanical alignment. There are various, yeah, that is the same summary. So complication the higher in the kinematic alignment or in the mechanical study. The stress force is higher in the kinematic alignment. Maybe this story is only the reflection. If we accept use the spherical or wide group component, this problem can be resolved. Okay. Patella tilts. So, but Dr. Hayashi is the ex-resident of this hospital, studied compared mechanical alignment and kinematic alignment in our hospital. So tilting is the smaller in kinematic alignment. So maybe one reason is, sorry, actually, I will talk next talk. Maybe one reason is we use subluxation approach because this approach, the all mass pulse from the bassus medial can be retained. So that's why the bassus medial pull the patella medial. So that can stabilize. And several doctors moved to the medial patella to subluxation approach after observation in our hospital. Then they moved to the subluxation approach. So patella tracking is very stabilized. So if every surgeon use subluxation approach, maybe most of the problem in the patellofemoral can be resolved, I believe. まあ、結局これ、 四頭筋っていうか内側広筋切れへんかったら、まあ、ほとんど問題ないし、もう全く意識したことないということなので、まあ、結構、これに関係するんじゃないかなということが考えています。だから、PM も、多分これを言うたら、問題視する人は多分文句言われへんと思うんやけども、やっぱり一番大事なのはここのところでしょ。これ以上やっぱり曲がったりとかするときに、やっぱり、それとこういうときに立ち上がったりするときとか、あと、もう屈曲の角度とかね、やっぱりこんなになったらやっぱり僕当たるんで、